So clinical trials in WM is very, it's very exciting. I mean, we have a lot of clinical trials. I think thinking about treatment naive population, I think the world is moving towards triplets. There's a study now in Canada running acalabrutinib, bendamustine, rituximab, for example. There's another study here in the United States that is running ibrutinib, venetoclax, and rituximab. Now, the beauty about these triplets, not only they are triplets, which is interesting, but also these are going to be fixed duration triplets. So they are containing BTK inhibitors, which classically are given an indefinite duration therapies. But these regimens are fixed duration regimens, either a year or 2 years of regimens and then of therapy, and then they stop treatments. I think that's an important message, or where the world of research is going to. Other combinations, we're combining BTK inhibitors with pretty much everything. So there are BTK inhibitors in combination with chemotherapy, BTK inhibitors in combination with protein inhibitors, BTK inhibitors in combination with BCL2 inhibitors. So there's a lot of these combinations coming up, which I think is interesting. Now, when we think about the relapse setting in patients who are heavily pretreated, then I think it's also very exciting because we do have, for example, CLR-131, that's a phospholipid drug conjugate, which is associated with a radioisotope. That is a very interesting mechanism of action, actually got a breakthrough designation by the FDA for patients with Waldenström's. We are running a study at the Dana-Farber Loncastuximab, which is an anti-CD19 antibody drug conjugate, which is approved by the FDA for diffuse large B-cell lymphoma. And so we're trying the experience in Waldenström's as well. There's another agent called pirtobrutinib, which is a non-covalent BTK inhibitor, which is different than the prior BTK inhibitors like ibrutinib, acalabrutinib, and zanubrutinib. Those are covalent BTK inhibitors. So when a patient progresses on a covalent BTK inhibitor, another covalent BTK inhibitor is not going to rescue that patient. But there's data now that these new non-covalent BTK inhibitors might actually exert efficacy even in patients who are losing the response to the prior generation of BTK inhibitors. So pirtobrutinib is one of them. Nemtabrutinib is the other one. So I think, that's a very interesting aspect. And we're coming up with combination treatments with these, non-covalent BTK inhibitors. I think that's another aspect that is very important. And again, immunotherapy, we are preparing a CAR T-cell program for Waldenström's at the Dana-Farber. I know there are a few other CAR T-cell programs in the country. I think Sloan Kettering, UNC, and Seattle are also running some CAR T-cell programs. So I really do see the future of Waldenström therapy, as immunotherapy. Exciting stuff.